Good day, everyone. I'm Dr. Yaroslav Gofnung, endocrinologist here at UCLA Health. Today, I want to talk to you about life after thyroid surgery. If you or a loved one have recently undergone thyroid surgery, you might be feeling a mix of emotions, questions, and even a little uncertainty. This is completely normal. I want to assure you that you're not alone in this journey, and there is hope for a fulfilling life ahead. One of the most common concerns after thyroid surgery is the need to take lifelong thyroid hormone replacement medication. Your thyroid gland makes hormones that help control your body's metabolism, and without it, you'll need medication to stay healthy. It may take some time to find the right dose that suits your individual needs, but once the right dose has been found, you can expect to regain your energy levels and overall well-being. Beyond the physical changes, it's important to also talk about the emotional impacts of thyroid surgery. The journey to recovery can be challenging, and it's normal to experience a range of emotions, including sadness, anxiety, or even frustration. Remember, you are not defined by the surgery. Take the time to process your feelings, seek support from loved ones or support groups. Don't hesitate to reach out to your care team when needed. Now, let's talk about the positive aspects of life after thyroid surgery. Many patients not only regain their energy levels, but also have an improved quality of life. Once your thyroid hormone levels are normalized, you can resume your normal activities, including work, hobbies, and exercise. In fact, some people even report feeling much better than they did before the surgery. It's important to approach life after thyroid surgery with an open mind and a positive outlook. Remember, regular follow-up appointments and ongoing monitoring are crucial to ensure your thyroid hormone levels remain stable. Your care team, including your endocrinologist, will be your partners on this journey, supporting you every step of the way. For more information or to see a doctor specializing in thyroid problems, please visit our website or call our office. Again, I'm Dr. Gofnung. Thank you for watching.